Good morning, all. Hope you all are well. So today's presentation is on specific sports injury and their prevention in wrestling. It will be presented by Dr. Hardik Patel. So I would request Dr. Hardik to start the presentation. Dr. Hardik, please unmute yourself. Dr. Hardik.
Yes, thank you, Gopalji. Thank you for the brief introduction.
Yeah.
So, good morning, all of you. Thank you, Gopalji, Sports Authority of India, and the CAIMS team for giving me an opportunity to present my view on injury prevention in wrestling. So, happy Ganesh Chaturthi, first off, to all of you. Is it visible, sir? Slide is visible.
Yeah, it is visible.
So our today topic is common injury in wrestling and its prevention. In this topic, we covered some basic introduction about the sports injury statistic in wrestling, common injury in wrestling like knee ligament injury, prepatellar bursitis, lateral ankle sprain, and shoulder dislocation, and its prevention strategy, how we can minimize the injury risk according to the nature and demand of sports. So sports injury, as per the according to the International Olympic Committee, they define the injury like any damage to the tissue of the body that occur as a result of sports or exercise. जो स्पोर्ट्स और एक्सरसाइज की वजह से आपके जो बॉडी पार्ट में जहाँ पे डे टू डे इवन माइक्रो ट्रॉमास होते हैं या फिर आपको कोई भी स्ट्रेच हुआ स्ट्रेन हुआ स्प्रेन हुआ बिकॉज ऑफ पार्ट ऑफ स्पोर्ट्स और एक्सरसाइज. सो आईओसी ने जो डेफिनेशन दिया है वो बेस है कि आपके जो इंजरी अकर हो रही है स्पोर्ट्स और एक्सरसाइज के ऊपर, तो उसको इन्होंने क्लासिफाइड किया है कि स्पोर्ट्स इंजरी. They further classified injury based on the mechanism and onset of symptoms. Suppose acute. Acute means any injury occurred due to the single identifiable trauma or cause. Suppose आप in case of if you are doing a practice on mat, अगर आप mat पे practice कर रहे हो और आपका जो ankle है वो opponent players की वजह से suppose आपका एंकल में स्प्रेन आता है या फिर आउटवर्ड ट्विस्ट हो जाता है, इनवर्ड ट्विस्ट हो जाता है, तो उसको कंसीडर करते हैं कि एक्यूट इंजरी. और ओवर यूज इंजरी का मतलब है कि इंजरी हैपन ड्यू टू द रिपीटेटिव कॉज ऑफ नेचर, मींस वहां पे आपका कोई सिंगल आइडेंटिफाइबल कॉज नहीं है, उसको कंसीडर करते हैं ओवर यूज इंजरी. इवन दे फर्दर क्लासिफाइड द injuries in where the location, like if the injuries occur in the soft tissue, hard tissue, or any other special area. So like in soft tissue injury, you can call the muscular injury. They further divided the injuries in based on the severities, type 1, type 2 and type 3. तो अगर मसल्स में चोट आ रही है तो उसको बोलते हैं कि आपका मसल्स स्ट्रेन हुआ है. जहाँ पे अगर आपका सॉफ्ट टिश्यू में लिगामेंट अगर आपका खींच रहा है, लिगामेंट में इंजरी आ रही है, तो उसको बोलते हैं लिगामेंट स्प्रेन है, लेटरल एंकल स्प्रेन बोलते हैं. हार्ट टिश्यू इंजरी में कंसीडर होता है आपका जॉइंट और बोन and any other special area like head and trunk, even skin, fascia. So injury statistic in wrestling. All you know about the wrestling. So wrestling is a combat sports, and the nature of sports require the different types of defensive and offensive maneuver. तो जहाँ पे जैसे टैक डाउन है, राइडिंग है, ग्रैपल है, पिनिंग मूव्स है, थ्रो है, होल्ड है. So we shows the higher number of injuries. You can many research articles says that the Greco-Roman style is higher than the freestyle, in particular the upper extremity injury. So the neck and upper extremity injury are more higher in the Greco style because of the even rules of the games. They are not allowed to hold the below the belt level. Second, almost the 40% of injury occurred in the 14 to 18 years age group. So definitely the early specialization and all the periodization, even extrinsic factor also look in for the particular to show the higher number of injury in younger population. Wrestling also demonstrates the 35 to 40% of injury in lower extremity because of the extreme position to hold in different position. 21 to 25% of injury in upper extremity just because of the even sometimes the lack of mobility or flexibility. 19 to 20% of injury head, spine and trunk area, and 24% of injury in others areas. These are the some mechanism of action and the type of injury seen in the different type of population in different age group category in wrestlers. तो जहाँ पे इंजरी आप देख सकते हो कि हमने डिस्कस किया प्रीवियस स्लाइड में अबाउट द एक्यूट इंजरी एंड ओवरयूज इंजरी सो वी कैन मिनिमाइज द सर्टेन एस्पेक्ट ऑफ द इवन context non-context type of injury if we are focusing on proper techniques, proper landing mechanism, proper weight and hydration management, so we can prevent this, we can minimize the certain types of injury risk in the wrestling. You can see the direct force is the highest percentage of injury in wrestling. Second one is twisting. Third is the stretch, and definitely the fall, even overuse are also the mechanism of injury in wrestlers. मैक्सिमम इंजरी जो बॉडी पार्ट के अकॉर्डिंग रेसलर्स में वो स्टडी शो कर रही है तो वहां पे जो आपका जो मसल्स इंजरी है, मसल स्ट्रेन है, जॉइंट स्ट्रेन है, वो सबसे ज्यादा मैक्सिमम इंजरी मसल्स में है और जॉइंट में है. देन फॉलोड बाय द फ्रैक्चर्स और इवन ACL tear and all. So common in injury wrestling. So today we will discuss about the knee ligament injury. Second is prepatellar bursitis. Third one is lateral ankle sprain. And fourth is shoulder dislocation. Just I will share you one video of the knee anatomy. So the video says that कि जो maximum number of injuries reported हो रही है वो high school athletes में हो रही है जो younger population है 14 to 18% of age group. और उसमें reported हुआ है the research says that the joint and the muscles injury are higher in wrestlers. So if we are planning on the good wrestling techniques, good landing techniques, even proprioceptive control, so we can minimize the certain aspect of injuries. Approximately 40% of injuries was reported in the takedown position. So the takedown position places the athletes into the extremely risk position and create the higher forces in the knee joint and even hip joint, which produce the more injury in lower extremity. Majority of knee injuries in wrestler in occur in the four component of ligaments. तो आप देख सकते हो, you can see the anterior cruciate ligament, just behind it posterior cruciate ligament, medial collateral ligament, and lateral collateral ligament. So this ligament provide the stability of the knee joint. So MCL ligaments connects the medial tibial condyle to the femoral condyle, medial femoral condyle. So this provides the side-to-side stability of the medial knee stability of the knee joint. The LCL provides the lateral knee stability of the knee joint, and the ACL and PCL provide the rotational stability. You can see the complete cut down of the ACL injury on the right side of the image. So the injury occurred due to if your one leg is fixed and you are pivoting on the leg with the valgus force, then it will be the chances of the ACL injury with medial meniscus. And the PCL injury particularly happen when your knee is hyperextended and the forces are directed towards your knee, which creates the posterior translation of tibia on the femur. You can see the type 1, type 2 and type 3 injury. टाइप 1 का मतलब है कि आपका लिगामेंट इंटैक्ट से लेकिन वहां पे यू फील सम टाइप ऑफ स्ट्रेच और प्रेजेंट, वहां पे स्ट्रेच है लेकिन लिगामेंट इंटैक्ट है. टाइप 2 में पार्शियल टियर है, सम ऑफ द फाइबर्स आर कट but the integrity of the ligament was maintained. In type 3, complete tear. So in the ligament injury, the athletes, the first symptom was to giving way your knee or his or her knee and to feel some instability, even the popping sound if there is the meniscus injury or even the ACL also. So we see the basic anatomy of the knee joint. Now, why the ligament injury was happened? So there are the certain factors according to the research. So the reason behind the ligament injury was for the even extrinsic factor. If we are practicing with the uh, experience or even higher age group or higher weight category, this factor are also aggravating factor for the knee ligament injury. Muscular imbalance, if your posterior chain musculature was not strong enough comparatively your anterior chain musculature, this factor also aggravate the knee injuries and poor recovery. So how you can prevent the knee injuries or even lower extremity injury in sports? So modified or correction of the extrinsic factor through the proper periodization and the plannings. Muscular imbalance, activate the posterior chain musculature and hip mobility, and adequate recovery through the proper weight management. If you are doing the proper warm up and cool down through the scientific approach, then the chances of the even contact or non-contact injury to minimize at least 10 to 15%. The second common injury in wrestlers is prepatellar bursitis. So what is the bursa? So bursa is the sac. The constant friction irritates a small lubricating sacs located just in front of the patella or kneecap. It's called bursa. आप देख सकते हो कि ये जो आपका जो नी जॉइंट है वहां पे एक फ्लूइड फिल्ड सैक होता है. अगर वहां पे कोई भी फ्रिक्शंस वगैरह मेट में रिपीटेटिव अगर आप टेक डाउन पोजीशन है फ्रीक्वेंटली मेट में आपका रबिंग हो रहा है टच हो रहा है तो ये जो वाटर है जो फ्लूइड है वो फ्रीक्वेंटली गेट इरिटेट और उसकी वजह से आपको स्वेलिंग्स वगैरह आती है. तो इसको बोलते हैं प्री पटेलर बर्साइटिस. हाउ यू कैन प्रिवेंट इट? यूज द नी कैप, relative rest, ice application, elevation, and if the swelling was persistent from 2 to 3 weeks, then please consult your doctor. Then third, we can discuss about the lateral ankle sprain. The maximum ankle injury was occurred over the lateral aspect. You can see the anterior talofibular ligament. This is the weakest ligament in the lateral compartment of the ankle joint. So when you are going to the practice on the mat and suddenly jerk occur over the inward direction, when your leg is moving in the awkward position in the inward direction, the chances of the ATFL injury are high. So what is the reason behind the lateral ankle sprain? One of the most common reason behind the lateral ankle sprain was balance, poor sensory motor control. सेंसरी मोटर कंट्रोल का मतलब है कि अगर आपके मसल्स जो और लिगामेंट जो प्रोप्रियोसेप्शन सेंस है वो अगर आपके प्रॉपरली एक्टिवेट नहीं है तो आपको इंजरी होने के चांसेस ज्यादा होते हैं. उसका मतलब है कि व्हेन इफ योर लेग इज गोइंग टू द अपवर्ड इनवर्ड पोजीशन एंड इमीडिएटली बैक टू द नॉर्मल पोजीशन देन इट विल बी द गुड साइन ऑफ योर न्यूरोमस्कुलर कंट्रोल. So that's why require the even single leg balance with closed eyes, balance with different object which target your proprioceptive system, which minimize the lower extremity injury. Poor muscular strength of peroneus longus and brevis. तो जो लोअर लेग के मसल से पेरोनियस लॉन्गस और ब्रेविस वो आपको जो आर्च सपोर्ट के लिए मेंटेन करते हैं और उससे उसकी वजह से जो आपका जो नी एंकल इंजरी है इवन नी इंजरी है उससे आप उसमें काफी चांसेस रिडक्शन होता है अगर इफ यू हैव अ गुड कंट्रोल ऑफ पेरोनियस लॉन्गस एंड ब्रेविस. Their muscle work like as a sling and to help to particularly activate the your everters of the ankle joint and the bending. First, we can see the video of the lower extremity injury prevention approach. Sir, video is visible, sir. Is it visible?
Yes, it is visible.
Yes.
So they are the planning the exercise for the barefoot approach to activate the neuromuscular control. So this is the example of the bilateral glute bridge. So this exercise particularly activate your glute and hamstring posterior chain musculature. And if you are engaged your hands on the chest, then the late activation are more higher in this position. Even you can plan this exercise through the loop band and even the TheraBand. Then gradually plan the exercise through the single leg hip extension or single leg hip glute bridge. So this exercise require more stability and even the hip external and internal rotation control. Now you can move the legs in the different direction also in the progressive way. You can plant the single leg balance on the even foam pad or unstable surface with eye open and eye closed to target the neuromuscular proprioception. These are the example of the dynamic instability and proprioceptive training or activation exercise for reduction of the lower extremity injuries. So you can balance on one leg and move the another leg in different direction to challenge the stability of the unilateral side. So these are some example of the neuromuscular training and dynamic control training for to minimize the lower extremity injuries. Now the shoulder dislocation. Again, in wrestling, the defensive position like a takedown, which aggravates the chances of dislocation. So the dislocation can occur when a wrestler takes a blow to the shoulder or fall onto the rotated and outstretched arm. You can find the joint deformity and dead arm symptoms, pain and swelling, difficult to move. So these are the common symptoms of this shoulder dislocation. What are the common risk factors for the injuries in wrestling? So previous injury, age and experience. If the athletes have a history of previous injury, then there are the 40% higher chances of injury in the affected side. Definitely, younger population has a more chances of injuries. Experience has a low reported a low number of injuries. Poor flexibility or mobility is one of the major reason for the lower extremity injury in wrestlers. Okay. Improper weight and hydration management. मैक्सिमम टाइम ऐसा भी नॉट होता है कि रेसलिंग में जैसे कंपटीशंस वगैरह प्लान होती है तो जैसे कोई एथलीट से उन्होंने प्लान किया है कि कंपटीशन में इमीडिएटली 3 to 5 to 7 kg वेट्स आपका 1 to 7 to 10 days में लॉस हो रहा है तो बिकॉज ऑफ दैट देयर आर आल्सो द चांसेस ऑफ इवन मस्कुलर इंजरी आर हाई. For the injury prevention, you can properly focus on warm-up. In warm-up, maximally they are planned the ramp protocol. Just I will share you the protocol. So Dr. Jen Jeffrey designed a framework that is useful for all in particularly all sports to help ensure your warm-up are properly structured. R का मतलब है कि to raise the body temperature, you can plan the variety of exercise like low intensity of running, skip jog, skipping, or to raise your body temperature, raise your heart rate, okay, respiratory rate, and blood flow for to minimize the injury. A means activate. Activate the key muscle which are used in training with use of loop bands, even big bands. So what types of periodization or what types of training plan based on that the activation plan is different. Mobilize the joint which are used in so that the dynamic stretching is preferable in warm up and static stretching is preferable in cool down and potentiate. So based on your wrestling or med skill, you can plan the potentiate of your workout. So these are some benefits of the warm up. You know that to improve the strength and power, the rate of force production, even reaction time, the muscle contraction, blood flow, even the oxygen delivery. So the proper warm up and cool down can minimize the risk of injury to 10 to 15% rate. So the wrestler, so just one sentence I will tell you. The wrestler must have the power of a weightlifter, the agility of a gymnast, the endurance of a runner, and the creativity of a chess player to succeed in his or her sports and to for the minimization of the injury rates. Thank you. Now can we
थैंक यू डॉक्टर हार्दिक. सो अभी मैं पार्टिसिपेंट से रिक्वेस्ट करूंगा कि अगर आपके कोई भी क्वेश्चन है तो डॉक्टर हार्दिक से आप पूछ सकते हैं. Participant, if you have any question, please may ask Dr. Hardik. किसी को भी अगर क्वेश्चन पूछना है तो वो अनम्यूट कर सकते हैं. डॉक्टर हार्दिक, आई थिंक कोई क्वेश्चंस नहीं है तो हम इसे क्लोज कर सकते हैं.
okay, thank you sir. Thank you all of you.
Thank you, Dr. Hardik. Thank you all participants for joining this session. Now we will meet on Monday. On Monday, the session will be on specific sports injury and their prevention in archery by Dr. Janki Panchal. So thank you for joining this session. Goodbye. Take care.